Welcome to today's National Health Council webinar, Why Climate Change Matters for People with Chronic Conditions. And I'm Randy Ruda, Chief Executive Officer for the National Health Council. Please note that we will be recording today's session so that it'll be available on our website for those that couldn't participate today in real time. But this webinar is being offered in conjunction with the release of a climate change focus briefing led by the National Health Council's Research and Programs team. The research brief, called Climate Change and Its Impact on Patient Health and the Healthcare Ecosystem, details health outcomes from climate events, barriers to treatment, inequalities that arise, and knowledge gaps that occur in patient experience research. And we view our National Health Council members as critical partners in combating climate change through the promotion of evidence-based information and science that inform our patients, our advocates, caregivers, and policymakers. And this brief is the first in a potentially ongoing research series focused on topics pertinent to patients with chronic conditions and disabilities. And we look forward to exploring cross-cutting climate issues from a patient-centered lens. Now, this brief was posted on our website this morning and is available for download at the link posted in the chat, as is the National Health Council guest blog that was created by the National Lung Association's editorial board and posted in October. These series of actions, including the webinar today, start to set the stage for the National Health Council to put together a statement on climate change and health as it relates to people with chronic conditions and disabilities. That'll be one of our activities early in 2023, and I'm really looking forward to getting started and putting that statement together on this critical issue. So let me now introduce our speakers for today. Laura Kate Bender is the National Assistant Vice President, Healthy Air at American Lung Association. Laura Kate has spent more than a decade working for protections from air pollution and climate change. At the Lung Association, she currently leads the Healthy Air campaign, directly advocating initiatives in Washington, D.C., field staff working at the state level, and coordination of a broad range, I should say a broad group of national public health and medical organizations. She previously served as the campaign's lead representative to Congress, advocating for limits on outdoor air pollution to protect public health. Prior to that, she worked in Virginia to implement Healthy Air campaign on the state level. She's also served on the board of the Virginia Asthma Coalition. Prior to joining the Lung Association, Laura Kate worked as an organizer on clean air issues for Environment America. Laura Kate, thank you so much for being with us today. Also presenting is Dr. Karen Heller, who's the Chief Scientific Officer at the Crohns and Colitis Foundation, where she's responsible for all mission-related activities, including a diverse research portfolio, education support, and advocacy programs. She's been a great partner to the National Health Council, let me say, so thank you for that, Karen. She has been instrumental in focusing the foundation on emerging translational research areas, including environmental triggers, fibrosis, and precision nutrition, and on clinical trial activities, including establishing a clinical trials initiative for patients and caregivers and expanding the activities of the foundation's clinical research networks to include adult, pediatric, and surgery research networks. Prior to joining the foundation as its first chief scientific officer in 2014, Dr. Heller was Associate Dean for Intercampus and Industry Initiatives at Weill Cornell Medical College. In 2021, she was chosen as a mentor in the Faster Cures Chan Zuckerberg Initiative Rare as One mentorship program. And as a member of the inaugural Springer Nature Research Advisory Council, she was selected in Crane's inaugural Notable Women in Health Care in New York City in 2018. So a very impressive set of credentials for both of our speakers today. Karen, Laura Kate, thank you so much for your thoughtful discussion. I will go through the questions that we receive in the Q&A with each of you after we've made both presentations, but I'm really excited for us to get started. So for that, let's go.
Great, thank you so much. So I really appreciate the opportunity to speak before you today and looking forward to a great discussion. I'm Laura Kate Bender, again, National Assistant Vice President for Healthy Air at the American Lung Association. As you heard, I come from an advocacy background as opposed to a science or medical background. And I'll walk through a few things today. I'll talk about I'll give a general overview of the health impacts of climate change. I'll do a bit of a spotlight on how they specifically apply to lung health and to patients with chronic lung disease that the Lung Association serves. And then I'll also talk a bit about the Inflation Reduction Act, because it is very relevant, very recent, and it stands to make some good changes on the clean air and climate change front. Next slide, please. I know you know the Lung Association, but I always like to start with our mission to save lives by improving lung health and preventing lung disease, and our vision that we're working toward, which is a world free of lung disease. Next slide, please. So I'll start off by quoting the National Climate Assessment. So the National Climate Assessment is a project of what's called the U.S. Global Change Research Program. It's a collaboration of more than a dozen federal agencies, and every 5 years they put out a report called the National Climate Assessment that looks at what climate change is currently doing across the country and what it's projected to do. They go by region, they go by topic area. It's a great resource, and they're actually in the works for the next round that'll come out next year. Climate change driven by greenhouse gases, we often call it at the Lung Association and other health organizations a health emergency. And this is certainly backed up by the National Climate Assessment. A couple key quotes: climate change affects the health of all Americans, and climate change affects human health by altering exposures to heat waves, floods, droughts, and other extreme events, so extreme weather, vector, food, and waterborne infectious diseases, changes in the quality and safety of air, food, and water, and stresses to mental health and well-being. Next slide, please. So I'll spend a couple minutes on this slide. This comes from the Centers for Disease Control and Prevention. The National Center for Environmental Health within CDC has a climate and health program that has some great resources on the health impacts that people are currently experiencing due to climate change, as well as what they can do to help mitigate them. So to start, I think we all probably tend to associate climate change impacts with extreme weather. So of course, extreme storms, hurricanes fueled by climate change come to mind most immediately. Of course, we can also see snowstorms and other weather events. Of course, that has an opportunity for injury. Of course, it has a mental health impact. I'll also talk in a little while about how anyone who has a chronic disease could be at greater risk of their lives being disrupted and their access to their care being disrupted because of severe weather. I'll also spend more time on air pollution. I'll just note here that climate change does make air pollution worse in much of the country. Of course, that exacerbates symptoms in anyone, but also for people with asthma and cardiovascular disease can be at the top of the list for some of those impacts. And then we have vector-borne diseases. I think the best way I think about this is a presentation I heard from someone who researches mosquitoes and mosquito-borne disease. And she said, none of the animals that we tend to like are the ones that thrive as the climate changes. As temperatures get warmer overall, the animals that tend to do best seem to be ticks and mosquitoes and other creatures that bring disease. And when it comes to plants, poison ivy, unfortunately, does great in a changing climate. So across the board, the organisms that thrive in warmer conditions that we're seeing driven by climate change, unfortunately, tend to be the ones that make us sick. I think if you're living on the East Coast, you've certainly likely seen a rise in the spread of Lyme disease. In general, we have vectors moving to places they've never been able to live before as the climate changes, and that's bringing diseases to places where they were once rare. When it comes to allergens, again, climate change is actually driving longer and more severe seasonal allergy seasons. And when it comes to water quality impacts, of course, there is a host of microorganisms that can flourish in water alongside increases in air pollution. When it comes to water and food supply, I know we'll hear more on food from Dr. Heller, but I'll just note that of course, extreme weather and other changes in the climate can make it harder to farm food, but they can also actually change the nutritional content and make food less nutritious, which is a pretty stunning impact. Of course, overall environmental degradation leads to all kinds of conflicts that can have their own health downstream consequences. And then finally, heat. And again, this is one of the ones that we're all probably most personally familiar with. Heat-related illness and death are rising. Extreme heat is rising across the US as well as across the country. And heat is actually the deadliest form of extreme weather. Next slide, please. I promise this presentation will not all be doom and gloom. We often say that anyone can be impacted by the health effects of climate change, but some people are at greater risk. So of course, these are just a few examples, but babies, children, and teens, their developing lungs, for example, put them at greater risk of the air quality impacts. Older adults tend to be at greater risk of many of these impacts. Pregnant people, due to systemic inequities like redlining and other racist practices, communities of color, as well as low-income communities, tend to be at greater risk of these impacts. Next slide, please. And then, of course, people with chronic disease. Now, this is not an exhaustive list. These are just a few examples. But again, people with a chronic lung condition, people with heart disease, people with diabetes, people with mental health challenges, all of these groups can be at greater risk of the impacts from climate change. And I'll also note that this list looks really familiar because it is also the list of people who tend to be at greater risk from air pollution. And I'll talk more about this in a couple of minutes, but air pollution and climate change go hand in hand, both in terms of their impacts and fortunately in terms of their solutions. Next slide, please. So to dig in on a bit, the Lung Association obviously works, as you all know, from working with us on a host of topics related to patients, but I work specifically on our outdoor air pollution and climate change work. Because I mentioned that climate change is a health emergency. Well, of course, again, hand in hand with that, clean air to breathe is essential for lung health. Climate change is actually making air quality worse in a few ways. So one of the ways is through warmer temperatures leading to more smog. There's all kinds of air pollution in the air, but two of the biggest and most widespread names in outdoor air pollution are ground level ozone pollution, also called smog, and particle pollution, often called soot. Ground level ozone pollution doesn't actually come directly from a polluting source. It actually comes from emissions from vehicles, power plants, some household products, other sources get emitted into the atmosphere and react in the presence of sunlight. And more heat drives more of those reactions. So what we're actually seeing is that as temperatures rise, much of the country is experiencing more days on which ozone is making it unhealthy to breathe. And the impacts of ozone pollution, again, anyone can suffer if the levels are high enough, but it's people with asthma and other lung disease, people with heart disease, and seniors are some of the folks at greatest risk of needing to seek care. And again, wildfires. I think, many of you on this call likely have firsthand experience with wildfire smoke. We know that climate change is making wildfires more frequent and more severe. And that's not only causing problems for those that have to immediately evacuate or who suffer damage or injury from fire, but of course from the smoke. Wildfire smoke is a major source of particulate matter air pollution, the other big national outdoor air pollutant that I mentioned. And particle pollution is really dangerous. It can cause, high levels in the short term can cause health impacts. Day in, day out exposure over the long term can cause health impacts, everything up from, respiratory challenges to heart disease challenges, all the way up to premature death, and can even cause lung cancer. And unfortunately, we're seeing that, these climate fueled wildfires are spreading wildfire smoke across the country. Even thousands of miles from the fires, and really exposing people to dangerous concentrations of smoke. And then the last air quality impact that I'll mention is actually indoor air quality. So if you are cleaning out your home, which has been flooded, for example, from sea level rise flooding or from a major storm, you are at risk of mold, other airborne contaminants that can degrade your indoor air quality as well. Next slide, please. So one resource I love to share with people is the Lung Association's State of the Air Report. We publish it every April. lung.org/SOTA is the URL. And we use air quality monitoring data from across the country to give letter grades and rankings to communities for how clean the air that they're breathing is. And what the 2022 report found is that despite lots of progress in cleaning up air pollution over the past several decades, more than 4 in 10 Americans are still living in places with unhealthy levels of air pollution. That's 137 million people in counties that got at least 1 of 3 failing grades by the measures in our report. Next slide, please. And what we really saw in this year's report was that those wildfires and their smoke impacts are showing up in our results. So not only do we have more people living with unhealthy air than we did in previous year's reports or at least last year's report, because of climate-driven wildfires and wildfires overall, We're also seeing that those extremely high short-term pollution levels are showing up in a way they never have before. So you can see this is an increase in the number of days that reach the most dangerous levels of what's called the air quality index. Basically, the two most dangerous categories of days. We saw a spike in very unhealthy and hazardous days for levels of particle pollution driven by those wildfires. Next slide, please. And I mentioned inequities. Of course, these impacts are not distributed equally. Our report found that people of color are 3.6 times more likely than white people to live in a county with all three failing grades for the measures of air pollution that we cover. They're also 61% more likely than white people to live in a county with at least one failing grade. So across the board, people of color are disproportionately represented in the most polluted places. Next slide, please. So of course, the impacts here are myriad. Just to name a few examples, if you have a chronic disease, in addition to the direct health impacts that we talked about on the previous slide, you also face these challenges with your care being interrupted, with needing to evacuate, which adds additional stresses. If you lose power or if there's damage to your home, that may impact your ability to get treatment or use your treatment that you have. Of course, wildfire smoke, either forcing people to evacuate or keeping them indoors and forcing them to make the air as clean as they can indoors is one that bubbles up to the top of the list for us and things that the Lung Association has responded to. Next slide, please. So what I'll do, I'll share a couple resources now that we pass along to our audiences at the Lung Association. And then after we hear from Dr. Heller, I'll circle back with some additional things that groups can do. Again, I don't want to imply that this is all despair. It's not. There's a lot of hope. So here are some things that we tell patients and others around dealing with the health impacts of climate change, especially if they have chronic lung disease. For wildfire, we have a host of resources at lung.org/wildfire. This screenshot here is from a video about how folks can create a clean air space in their homes. We also advise people to check in with their doctor to find out if they need to change their oxygen use, to have a plan for when to seek medical attention, how long to watch for breathing issues after exposure, what to do during cleanup, a host of resources that folks can use to make sure that the air that they're breathing during a wildfire smoke event is as clean as possible, and to know what symptoms to watch out for. Next slide, please. And then again, I mentioned hurricanes and flooding probably come top of mind to a lot of people first for climate disasters. We have resources on both of these as well as other disasters at lung.org/disaster. We highlight some of the risks, including to people with chronic lung disease, of hurricanes and flooding events. Of course, standing water can carry bacteria or other microorganisms or garbage or toxics. We also have to make sure that we educate folks about how to power their home if they do lose electricity. For example, how to properly use a generator so they're not putting themselves at risk of carbon monoxide poisoning. Helping people have a plan for what to do if they do lose power and have powered devices that they need to use. And then tips about ensuring that people identify what needs to be removed during cleanup from a flood and what are some additional risks they should be on the lookout for if they have to evacuate. Next slide, please. Some of those things we share too are ways to be prepared ahead of time, ahead of the flood, having a plan, having all medications, having an extra copy of prescriptions, having all their insurance and physicians' informations. If they have an asthma or COD action plan, bringing it and creating it all in a pack that can be carried with them if they have to evacuate or otherwise seek treatment during an emergency. There's a lot that patients can do to be prepared. Next slide, please. So next, I'll highlight one other report that I highly recommend on climate and health, and that's the Lancet Countdown Report. So every year, the Lancet Medical Journal releases its countdown report that looks at key climate and health indicators. That release also includes a US brief that dives into US specific issues around climate change and health. And a key quote from an earlier version of this report, climate change is the greatest global health threat facing the world in the 21st century, but it is also the greatest opportunity to redefine the social and environmental determinants of health. So to dig in onto this a bit, we have an opportunity not just to reduce the greenhouse gases that cause climate change, but also to help people adapt to the health impacts that we can avoid. And as we're reducing greenhouse gases, to make decisions that clean up everything else at the same time. For the Lung Association, this is particularly impactful because the same sources, for the most part, that are driving climate pollution are also contributing to air pollution. And so for us, our North Star is really policy that makes sure that we transition the country away from polluting sources of energy, whether it's for transportation or electricity generation. Basically, we don't want to be using fossil fuels and we don't want to be burning things. That is what's driving both air pollution and climate change. And moving instead toward a zero emission future. So zero emission, truly renewable, non-combustion electricity and transportation as our North Star. And the good news here is that, again, we can use one solution to solve for problems at once. If we are taking these actions to reduce climate pollution, we're also advancing health equity, cleaning up the air we breathe, and improving health overall. Next slide, please. So I will shine a quick spotlight on the Inflation Reduction Act. I know National Health Council is very engaged. I will speak to the clean air and climate pieces of this bill because from our perspective, this is the biggest investment in clean air and climate change that we have seen Congress make. It's a huge deal. And a lot of those investments are targeted at solving for climate change, air pollution, and environmental justice at the same time. So I'll highlight a few of the things that pass into law. It includes tax credits for truly zero emission forms of electricity like wind and solar. It includes tax credits to help individuals purchase zero emission vehicles, new and also in the future used EVs. It includes a new program that will help limit emissions of methane, another potent climate pollutant from the oil and gas industry. It lets people get, or will let people get rebates for swapping out their appliances with zero emission or more efficient appliances in their homes so that their homes are not adding to the burden of climate change. And it includes community level investments for air quality monitoring and for environmental justice work. Now, where things are with the Inflation Reduction Act from the clean air and climate side is that EPA, the IRS and other federal agencies are currently taking comment on how to build out these programs. Some of the benefits will be available pretty quickly. So for example, some of those IRS tax credits are rolling out now or rolling out soon in the next year. And then some EPA is now standing up programs with public input to get as much of the money out the door as quickly as possible, as equitably as possible, because obviously there's no time to waste and this needs to get in the hands of the groups that need it most, who are on the ground experiencing the worst impacts. I'll talk a bit more about opportunities to engage at the end when I talk about ways that health groups can work on climate and health issues. But in the meantime, I will turn it back to Randy, and I really appreciate everyone coming today.
Well, that's just great. Thank you for all that good information. I know we'll also be interested in have you share how groups that are on the call today that are in National Health Council membership can build on and apply what you were sharing just now with their own constituencies. But let's go now to Dr. Karen Heller from the Crohns and Colitis Foundation. Karen, why don't you share with us your thoughts, and then we'll circle back and maybe get some specific recommendations on the groups that are on the call and others, how they might go forward with some of this good information, and we'll also take questions. But Dr. Heller, please proceed.
Thank you so much, Randy. So I just want to comment that Laura Cade has really done a great job laying out the acute impact of climate change and pollution and other aspects on it on health and disease. And particularly, of course, with the focus on clean air and not clean air, it's pretty intuitive how this can have an impact on diseases like asthma and other respiratory conditions. I'm going to take a different point of view because as the Chief Scientific Officer at the Crohns and Colitis Foundation, where our mission is to cure Crohn's disease and ulcerative colitis and improve the quality of lives of people living with those diseases, I'm going to take a point of view of really the long-term impact of climate change and on Crohn's disease and ulcerative colitis, but on many chronic conditions. Next slide. And what I'm going to walk you through is how climate change will lead to, has led to already, a decrease in biodiversity, which is leading to a decrease in microdiversity and resulting in microbial dysbiosis and increasing chronic disease. And first, I'm going to define these terms. Next slide. So we know that biodiversity and macrodiversity really is talking about the population level of species and what is in the environment, globally. Microdiversity looks at single organisms within a particular environment, for example, in the gut. The human microbiota are the bacteria, fungi, viruses living in or on humans. And we're really talking about more than 100 trillion microbes in the body and more than 160 species in the gut. And for most people, if we're not sick, we live harmoniously and depend on these microbiota living symbiotically with us. We further define the human microbiome as all of these organisms and the genes that they produce. And that's really important because the microbiota, the genes, and the products all influence our health. Next slide. I'm sorry, click, because it's animated. Yes. And so I'm going to spend a lot of time talking about the human gut microbiome. And that's because it plays a fundamental role in moderating nutrient absorption, regulating host immune system, defending against pathogenic microorganisms, and particularly maintaining the integrity of the barrier of the gut. So when whatever's inside your gut or you're putting in your gut doesn't enter the body if it isn't wanted. And so it's really important to understand the central role of the human gut microbiome in health and chronic disease. Next slide. So we know, and certainly Laura Kate presented a lot more information about this than I'm going to, but we know that climate change reduces biodiversity. And every year or every 2 years, the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services puts out reports. And in 2019, they said that biodiversity is declining faster than at any time in human history. Nearly 1 million animals and plant species are threatened with extinction. And in 2021, they added that the impact of climate change, because there are many things that impact it, but it's projected to, there are many things that impact biodiversity, but the impact of climate change on biodiversity is projected to lead any other threat during the 21st century. So climate change is having a major impact on reducing biodiversity. Next slide. And now there's a hypothesis that reducing this biodiversity, this macrodiversity, leads to reduced microdiversity. And that's because reducing the contact between people and a biologically diverse environment, which is what we want, is being reduced because there's less biodiversity in the environment, and this may adversely affect the microbiota, including in the human gut and its immunomodulatory capacity. Next slide. So possible mechanisms for this effect are diet, and as Laura Kate mentioned, we know that and the environment is changing food and aspects of food. And it's also another mechanisms is the surrounding environmental microorganisms, as I mentioned. Then possible mechanisms relate to health status, drugs, hygiene. All of these can impact the microbiome, and diet and the surrounding environment certainly are impacted by climate change. Next slide. So we know that reduced microdiversity leads to the microbiome dysbiosis. And so dysbiosis really means that the microbiome on humans gets out of whack. And when it's in the right balance, eubiosis, the good microbes balance out the bad microbes, and it all lives harmoniously and people feel fine. When it gets out of whack, the bad microbes overwhelm the good microbes and bad things happen. Next slide. As I mentioned on an earlier slide, bad things happen because you have changes in nutrient absorption and metabolism. You have major impact on immune function and immune response. And you have other things happening within the body that reflects this changing microbiome. And it's now, it's more than hypothesized. There are data to support an association of all of these diseases, these chronic diseases, with changes in the microbiome. Of course, I spend a lot of time thinking about those changes in inflammatory bowel disease, Crohn's disease, and ulcerative colitis. And we were among the leaders, the Crohn's and Colitis Foundation, in funding research in understanding the microbiome and dysbiosis of the microbiome. Since then, it's become clear that it's associated with allergies, especially when you look at the changing intestinal microbiome of neonates. It's associated with asthma. It's now known to be an association with neurodegenerative diseases like Parkinson's disease. It has an impact on various liver disease like fatty liver and cirrhosis. It influences obesity, type 1 diabetes because of the immune response, type 2 diabetes because of other aspects of having an impact on metabolic diseases, and cardiovascular diseases. And this, as you can see from the list of these diseases, we're talking about most of the chronic diseases in the world. And there are studies also to suggest changes in the microbiome and various cancers like colon and rectal cancer. So we now need to really reframe our thinking about the environment to recognize its impact on the microbiome, and therefore its incidence and prevalence of these chronic diseases. Next slide. I'm going to spend a couple of minutes really highlighting this for Crohn's disease and ulcerative colitis. We've known for some time that, that these diseases come about because you have a genetic predisposition, you have an abnormal microbiome, and oftentimes we'll see evidence of the abnormal microbiome, the dysbiosis, before symptoms even occur. And the changes in the genetic predispositions, the changes in the microbiome lead to an altered immune response. And so you get an immune-mediated disorder attacking cells and tissues that shouldn't happen. And we know that for all of this to occur, we need environmental triggers. Click. And so we know that the gut microbiome dysbiosis is critical to the onset and the progression of Crohn's disease and ulcerative colitis. And when we think about additional environmental triggers, next slide, we know that diet plays a key role in triggering this disease. And we've heard that diet is influenced by the environment and changes in the environment and climate change. We suspect, we don't have good data yet, that environmental pollutants also are influencing the incidence and onset of Crohn's disease and ulcerative colitis. There are data to suggest viral infections impacted. Antibiotics are thought to impact it, especially when we know that early use of antibiotics in neonates influences their microbiome for a long time. We know that stress and smoking, and there have to be others. And so what is the outcome of all of this? We see an increased incidence of Crohn's disease and ulcerative colitis in countries that have showing an increased westernized lifestyle. Clearly, the diet has something to do with it, but some of these other factors are probably influencing it. We know that children of immigrants, they gain the same incidence of these diseases as their adopted country. And you can't have genetic changes that quickly. So clearly, these are epigenetic changes due to triggers, most likely diet, possibly the pollutants, as I said, possibly other triggers. And then we know that there is this really important interplay between diet and changes in the microbiome, so that food changes the microbiome changes food, has an impact on immune response. Similarly, and even food can influence, cause sort of epigenetic changes in what genes are turned on and off. And we know the importance of diet and immune response in disease when we look at disease like celiac disease, with the intake of gluten has a major impact on the immune response in that disorder. In something like Crohn's disease and ulcerative colitis, we don't have a complete handle yet on the kinds of foods that do that. But we certainly know that ultra-processed foods are a bad actor in this disease, and we don't know how environmental factors and climate change really are influencing how people are using food and processed food. And next slide. So in conclusion, I just want to reiterate that we know climate change reduces biodiversity. We know because of our interactions with the world around us, this will and does reduce the microdiversity within the human body, and particularly within the gut microbiome. This leads to alterations, and most likely bad alterations, so the microbiome being out of whack, which has an impact on chronic disease, a lot through the immune response, but through other effect on nutrients and managing other types of infections, so that it has an impact which will undoubtedly lead to an increased incidence, prevalence, and possibly worsening on the individual level of a large number of chronic diseases. So it's, I think, a new way for us to be thinking about climate change and chronic disease, and one that really warrants our attention. Thank you.
Karen, that's great. Thank you so much for those comments. And I think your comments in conjunction with Laura Kate really give us a comprehensive, understanding of just how climate change is affecting personal, individual, population health, from the micro, as you just described, to the very macro, that I think Laura Kate was describing. I know you both have some additional recommendations on how can groups like the National Health Council and its membership become more informed and more engaged. And I've got a lot of questions in my mind as to, so how do we translate this information to work that we do as an organization, and then also information to empower patients in the individual ways that they navigate their chronic conditions and health, or step up as activists and advocates for the environment and for ways in which to combat climate change. Laura Kate, you mentioned that you had some additional thoughts that might help us understand that, and then know that I'm going to look for each of you to describe what was the journey of your organizations in even coming to think about climate change as an organizing factor within your organizations. But let me start with you, Laura Kate, because you said you had some additional recommendations on, well, how can the participants in this call and others who bring it up online learn more or engage better?
Absolutely. And let's go to the next slide, please. So the first, and these are some initial starting points for ideas, but the first, as you said, is to communicate climate impacts with patients. There is a lot more that we can collectively do across the community of health organizations that we are to help people understand that climate change is impacting their health. It is not just about the ice caps somewhere far away. It's not polar bears. I mean, it is, but it's also about their families, but that there are things that they can do to protect themselves, things that they can be on the lookout for, ways that they can prepare for impacts or deal with the ones that they're currently experiencing. Of course, helping health professionals across the spectrum better understand the impacts on climate and health. And those are, obviously the research is changing all the time. But, I've talked to so many physicians, nurses, and others who said, this was never a part of my curriculum, who are now working to make sure that it's part of future curricula. And I'll also add advocacy there. Again, I'm coming from the advocacy perspective, but, helping health professionals understand that they have the tools and can be equipped with tools to bring their expertise to decision makers and advocate for policies that protect their patients. There are lots of great efforts out there to reduce climate and pollution impacts of the healthcare sector. The healthcare sector, of course, is a major contributor to emissions, both on the climate side and also on the air pollution side. And so if folks want after this, I'm happy to share some suggested organizations who are doing great work on this front. And then again, advocacy hat. There are a lot of opportunities at the state, federal, and local level to advocate for protections. I'll just name a few, and I'll say as a starting point, I think, one of the things I spend a lot of my time saying to the individuals that work with the Lung Association, be they patients with a personal story or health professionals, is, their voice has a lot of value. I am a DC-based advocate. I believe it's the Pew Public Opinion Survey shows every year that nurses, and I think followed by physicians, are the most trusted professions in America. Lobbyists are the least trusted profession. So the more that we can collectively do to tell patients as well as health professionals that their voice really matters in this, they are listened to, that they have expertise that is relevant to decision makers, and that they do not need to be intimidated to come to the halls of Congress or testify before the federal government, the better. A couple of those opportunities right now. One is that in addition to the great progress we've made with the Inflation Reduction Act as a country, there are a lot of things that need to happen in terms of regulations and standards from the federal government, particularly the Environmental Protection Agency, that could further ratchet down on the sources that are contributing to climate and air pollution. EPA is either working on or getting ready to work on stronger standards for the oil and gas industry, for power plants, for trucks, for cars, better national limits on soot. All of these things are going to be politically challenging to get across the finish line. And so the more we can collectively lend our scientific expertise to EPA to make the case for them, and then generate public support among our communities to help show, no, that the public really does want cleaner air, the better. And I'm happy to be in touch with ways to do that. I mentioned earlier the Inflation Reduction Act. There are lots of opportunities to engage on how it's implemented. But then I think there will be concrete things that we can pass along to patients and others, ways that they can use the law's benefits to actually make their own lives cleaner, their own homes less polluting. And finally, I'll give what I have been calling a shameless plug. The Lung Association convenes a coalition of health organizations coordinating our advocacy around some of these topics. So if you're interested in your organization getting involved in advocacy on clean air and climate issues as they apply to health, I'm always happy to be in touch. We have a place to plug into, and we try to make it as easy as possible for groups to engage on especially federal advocacy issues where they might not otherwise have the opportunity. Mm-hmm. Thank you.
Well, thank you for that, Laura Kate, both for the information, boiling it down to, those entry points for engagement for organizations, across our membership, but your willingness to be a resource, as we really become better informed and just think about these issues that are in the headlines every day and how they relate to our own constituencies. Karen, anything further to share from you, kind of thinking about that journey that your organization took? Obviously a lot of the science and medical expertise that your organization has is really impressive and in some ways unique, to compared to some of our other members, but somehow you really got your arms around this issue, understood how climate change and conversations like that fit with what you're seeing literally internally to the constituency you serve. Talk a little bit about that journey and then what observations might apply to some other groups that are just starting on this path.
Right. So as I said, we started early thinking about the gut microbiome and IBD because that is where the disease is. So it was
Mhm.
sort of an obvious connection to study that. Where we're advancing is that we recognize that there are these environmental triggers because people can need a trigger to go from sort of changes in the microbiome, being genetically predisposed and having an immune response. And so we've been doing some work on environmental triggers like stress. We really want to do more. We are hoping in the future we're going to be launching a direct-to-patient cohort so we can hear
Mhm.
directly from patients. And we really want to eventually collect information from them about their environment, especially because we know that actually within families they get IBD. And actually what's super interesting is that dogs of families with IBD get IBD.
Hmm.
So yeah, so there's something in the environment
Right.
of the family, and maybe it's food, maybe it's other things. So this is something that we are very interested in. We need more resources to address this, but we really, and I think it's true for most of the immune mediated diseases, what are the environmental triggers that sort of push somebody over who have those other predisposing factors? And so
Mhm.
that's what we need to know.
That's so helpful. Let me invite any of the participants in the call to share their questions or maybe comment on some of how their organizations have reflected on these issues. Put those in the chat and I can invite you to comment directly. I think also just kicking off this conversation, as I mentioned earlier in our call, really is setting the stage for the National Health Council just to, check in with its members, understand where there are those links. We do just have a comment that came in from Olivia Casey. Olivia, do you want to just go ahead and share your comment with the group and get some feedback?
I'm not sure, Randy, I know how to take that and turn it out to all everyone. Let's see.
Sure. Well, I'm just looking at your comment and you talk about the dog aging project. Give us a little, perspective on just why you raise that in the context of this conversation. And by the way, great to hear your voice.
Oh, thanks. The dog aging project is done by Duke, and it also extends to UC Berkeley and universities throughout the U.S. It has over 10,000 dogs in the registry. They collect a great deal of data. It's longitudinal. I want to say it's like 10 years old, but they collect so much environmental data. It would be really interesting to know if there was any way to cross-reference that with the owners. I happen to be I am not. Sherman is a PAC member, my Great Pyrenees, but they collect significant amounts of data and they do it annually. So it'd be really interesting. I would just be fascinated to know if there was the corollary there. I had no idea that there was a corollary between animals and their owners having IBD. That's very fascinating. Thank you for sharing that.
It is interesting. And Dr. Heller, I saw you nodding. I mean, just from a research, and science perspective, those kinds of discoveries are just so interesting to us. And particularly if it's got such a credible, entity in terms of Duke that's really looking at this. Olivia, you've done a lot of work in the BIPOC community. I know that's been an area of interest of yours. As you listen to this conversation, not to draft you as a keynote speaker at the last minute, but I'd just be curious as to any reflections you had as both Karen and Laura Kate pointed out how, certain parts of society are really adversely and disproportionately adversely affected. Anything that you've come across in the work you've done with member organizations of the Health Council that would give you any insights there that might have particularly resonated?
Randy, it's kind of funny you bring this up. This morning, and I assume Dr. Heller is probably already familiar with this. Dr. Fred Miller and his group released another paper with regards to the ANA study that was done, I think, in 2021. and the very strong corollary that they have with environmental factors, and the statistically dramatically increasing ANA presence, most specifically in the youngest cohort, which I believe is 12 to 18. And they have conclusively, I believe it is, they are pretty close to conclusively drawing that corollary. And we have had offline discussions with regards to the increases, like, for example, in one of the ANA lupus studies, with the African-American cohort had a 14% mortality rate, whereas the non-African-American cohort had, I want to say, 4 to 6% mortality rate with the same longitudinal time stamp. So I know that there is some concern that this is an environmentally induced, well, there's a whole series, but that there is an environmental corollary there. And we simply don't have the data now. I mean, you know, if you look at, for example, Houston, Texas, and where many people in minoritized communities are living near, well, locations where there's a great deal of chemical input, we just don't have the data. And it's just so very, very concerning to us as an organization that we don't. And right now, to my knowledge, I mean, there's just nothing that's centrally located where we can actually draw that line and be able to say, you know, this is a real issue. But certainly we're seeing the impacts, and in our roundtable discussions, we definitely have seen this, heard this, I should say.
And I think both of our speakers, you know, flag that is an issue of concern. One of our National Health Council member organizations, the National Minority Quality Forum, Gary Puckrin is the CEO there. They have really focused on this issue, that disproportionate and harmful impact among people who are in the, let's say, the communities of color, Black and brown communities in particular, from, I think, being affected by all of the things that were raised by our speakers today. And I think we can put that, their good work in the mix as we have future conversations. Any other thoughts, final thoughts that you might have, Laura, Kate, or Karen, that you'd want to leave with our participants today, and kind of recommendations for the National Health Council on how we can be helpful to you, both as leading organizations in this space, to continue to help really that broad range of member organizations that we have that are primarily patient organizations, but partners and researchers and others that could play a role. Any last thoughts or a call to action for us?
So from my point of view, it gets to something you and I have discussed before, and that is that I think that we're stronger if we think about the immune-mediated disorders, the autoimmune disorders, to really get a better handle on environmental impact, which factors are relevant, how they're influencing it. I think if we come together around that, it would probably be a more efficient and effective way to come to some answers.
Great, I appreciate that. And that's part of what this effort is starting to do. I think the Health Council may or may not have dramatic expertise in a specific area, but we can convene, we can encourage both within our member organizations and external experts to come together and explore those issues that you flag. Laura, Kate, what about you? I think you did include in your presentation some very specific places where, as advocates, as patient educators and navigators, supporters, we might infuse this expertise, the sense of concern, the need for action. Any final thoughts?
Yeah, absolutely. And I really appreciate the work the National Health Council is doing. Looking forward to helping however the Lung Association can. I think I'll just say, you know, there's so much to do, but there's so much opportunity for everyone's expertise to plug in. And of course, when it comes to reducing the pollution that's causing climate change, there's powerful health arguments to be made, and all of our organizations are important messengers there to highlight for decision makers what the health benefits would be. But then also, you know, we are, all of us, and some of us more than others, depending on where we live, are experiencing health impacts of climate change today. And so there's just as much opportunity on the adaptation side. And there are real solutions that, you know, that communities across the country are employing, you know, Mapping and adding more cooling centers for high heat, teaching physicians how to identify cases of Lyme disease when it's newly emergent. There's all kinds of work to be done on the adaptation side too. And so that, that's really where the rubber meets the road and helping people protect their health from the impacts of climate change.
Absolutely. Well, thank you both so much for your presentations today, for your innovative thinking. Thank you, Olivia, for being willing to be drafted as a third presenter at the last minute there. But this is not the beginning, because clearly we have organizations like yours that are clearly already playing a leadership role. But it may potentially be a place where the National Health Council can step up exactly the kinds of roles that you described, and just make sure that we're facilitating the kind of conversation, consideration, and then also advocacy voice that patients and patient groups are uniquely empowered to bring forward. So thank you both very much. I'm sure we'll have some other questions that kind of straggle in as your materials are digested and as others pull up this presentation. And I'll look forward to working with both of you and your organizations in the year ahead. This is really important. And thank you for the excellent work that you're doing. So have a wonderful rest of your day. And thank you everyone for participating this morning. Take care.